Welcome back. Premier Doug Ford is calling on U.S. President-elect Joe Biden to help secure more COVID-19 vaccines. As the province learns, it will not receive any of the Pfizer doses expected next week. Now, despite this, Ford says health officials have completed the first round of vaccinations in all long-term care homes in the 4 worst hotspots ahead of schedule. A lot to discuss here. Dr. Zane Chagla joins me now for the latest on how Ontario is doing in this fight. Good morning to you, Dr. Chagla.
Good morning.
So let's begin first with the vaccines. Obviously, this is a major setback when it comes to the rollout of what's happening. Your take on where all of this goes from here?
Yeah, I mean, this is our biggest tool right now, right? You know, we have community rates getting out of control, though slightly getting better. There are the 4 long-term care cities that have gotten immunized, which is fantastic. But the reality is there are other hotspots across the region that still need help. The Niagara region, there's always a threat to the north. There's, threat down towards Sarnia-Lambton. And so, there are certainly many, many more care facilities, long-term care facilities that need to be done. There are high-risk retirement homes that need to be done. There are healthcare workers in those settings that need to be done. And so, we had the infrastructure to get people immunized. It has to stop and circle back to people getting their second dose. So at least we finished the series for those folks. But yeah, I mean, more vaccine cannot come soon enough. There are basic needs in long-term care retirement homes, and then that doesn't even incorporate hospitals and the acute care sector.
How far do you think this will set us back with the rollout of the general population being able? Every conversation I have is someone saying, when am I going to be able to get it? I know I'm not at the front of the line, but when will everyone feel safe again? I know that's a very loaded question, but
no.
What do you think?
Yeah, I mean, so with this infrastructure that we've been using to try to vaccinate people, at least our healthcare workers, if a miracle amount of vaccine shows up next month that makes up for all the losses, there's still going to be a limit to how much you can give to every person, right? So that first phase of those vulnerable individuals is going to take a little bit longer. As much as we try to play catch up, there's only so much you can catch up in a set amount of time. So, I wouldn't necessarily say that folks are going to wait that much longer. I think the projections from the province where everyone would have access by August, maybe that's September now, but any more delays are going to keep rippling and rippling down, knowing that this is a huge global supply chain and we've already had one point of instability so far.
From a more local level here, I know a lot of educators, parents, students are paying very close attention. Everyone is doing the virtual learning right now. And we know with the hot spots, the earliest we're going back is February the 10th, Toronto, Peel, York, Hamilton, Windsor, Essex. All of the other school boards are sitting, waiting, watching. What do you think the threshold should be or could be to make the decision on whether or not kids are going back sooner rather than later?
So the CMOH had set a target as 1,000 cases per day and 150 in ICU, knowing that healthcare capacity is really one of our last resorts at that point. Obviously, if hospitals fill up, it impacts everyone. That being said, I think there probably is going to be some wiggle room. I hope that places like, for example, Northern Ontario, which has been doing okay and rates have been coming down, are hope that schools open a bit sooner. Even regions that respond very well to these lockdown measures, which we're seeing in places like Windsor, Essex, London, are able to get to that earlier date, knowing the value of children being in school and really that being the only thing that's open at that point. So, I think the 4 hotspots are destined, unfortunately, to the last date. And hopefully, if things do keep improving as they seem to, that the other places are on target. But realizing that there is still a healthcare objective and an ICU objective, and that may not respond as well to these lockdown measures or may be a bit delayed from these lockdown measures.
Okay, so we'll be waiting on that. I know they gave that January 20th date, which is today, as the deadline on when everyone will know from the public health units to be communicated to parents and teachers and students. So we'll be watching that one very closely. Dr. Chagla, you are being very generous with your time. You are sticking around to answer some of our viewer questions. So if you have any, please do call in or email us, 1-866-267-3797, feedback@breakfasttelevision.ca. Dr. Chagla will try to take as many as we can. That's coming up in 15. We'll talk to you soon. Thank you.
No problem.
Let's bring in Frankie. I know you are waiting. You're waiting in your school board right now to see if your boys are going to go back on Monday.
Yeah, you got it. I'm in Simcoe County, just north of York Region in Bradford, Ontario this morning. We're waiting to see what's going to happen. I got an email yesterday from the teacher saying that they'll let us know later today as well. Look,